Please welcome Nguyen Thi Thuy Ngan from OUCRU.
So, good morning, everyone. Nice to see you here on today. I'm a doctor, and when I'm talking about brain infections, it seems easy to me because I see it every day at work, case by case, day by day. Based on the medical textbook, lectures at university, updated medical training, the knowledge about this disease is enough for me to diagnose and treat patients with brain infections. This disease is really dangerous and causes a lot of bad results. Patients can have blindness, deafness, convulsions on their lifetime since the day they got brain infection and even die. And an early proper diagnosis and treatment can help them to deal with this problem. But how can we get it? Coming back to my situation, working as a clinical environment just give me experience, but not that case when I think how I can improve diagnosis and treatment for patients. Especially when I started my PhD working as a researcher and with the motivation to bridge the gap between practical clinic and the academic aspect, I do see my understanding of brain infections is not good enough to go further, but I know that I have to go step by step. And for the very first step, I suppose that I should perform a descriptive study on brain infections at my workplace, Chợ Rẫy Hospital, one of the biggest settings in the country where we receive 1,000 cases of brain infections every year. And a lot of questions were asked. Patients with brain infections, who were they? Where did they live? How they get the disease? And how did the disease develop and end? And thanks to a very simple tool in the study we call retrospective study that allow us to stand at the current position to look back the past 10 years. And we collect information from patients with brain infections, and then we can broaden the scope of the disease by seeing the trend, the changes, and the constancies over time. Not only this, the result can tell us more understanding about the characteristics of brain infections and tell us what we should do to improve the outcome of patients suffering from brain infections. Thank you.